Hello everyone, I am Dr. Ashish Desai, Consultant Brain and Spine Surgeon at Adikura Super Speciality Hospital. Friends, recently we observed World Head Injury Awareness Day on 20th March. It aims to throw light on head injury, its causes, various types, treatment options and preventive measures that we all should take in our day-to-day life. Today I will share some information about head injury. According to CDC, Center for Disease Control and Prevention, the major causes of head injury are motor vehicular accidents, falls, physical assaults, and sports-related injuries. Certain non-traumatic causes for brain injury are lack of blood and oxygen supply, pressure from tumors, infectious disease, and the effect of certain drugs and toxins. There are different types of head injury, like concussion injury. It is a mild variety of head injury that is caused due to a blow to the head, and it may or may not be associated with loss of consciousness ranging from a few minutes to a few hours. It is caused due to temporary cessation of the essentially normal brain functions. Certain patients do report a brief period of amnesia or forgetfulness. Skull fracture. A skull fracture is any crack or break in the skull bone. It may be a linear fracture, which is more common, or a depressed fracture in which the skull fragments are indriven into the brain. It may or may not be associated with severe brain injury. Hematoma. It is bleeding within the skull which can occur in and around the brain. It may be mild or can be even fatal. Extradural hematoma, subdural hematoma, subarachnoid hemorrhage, intraparenchymal hemorrhage and intraventricular hemorrhage are various types of brain hematomas. Next is the diffuse axonal injury. It occurs due to shearing forces acting on the brain cells or axons, and which is caused due to acceleration-deceleration motion of the brain. Usually it is more severe than that seen on the CT scan. The damage here is at the microscopic level and usually there is no gross hemorrhage. Trauma to the brain should never be taken lightly. One should always consult a specialist when one experiences the following symptoms: headache that is not resolving or worsening, vomiting, loss of consciousness or drowsiness, convulsions, imbalance in walking, weakness of the limbs, forgetfulness, speech and visual difficulties, and ear, nose or throat bleeding. In children, in addition to the above symptoms, if the child is unable to stop crying or refuses to eat, then expert medical advice should be sought. The diagnosis of a head injury is made by clinical examination by a specialist. Additionally, tests like CT scan or the MRI are advised for further evaluation. Treatment of the head injury depends on the type of the head injury. Large hematomas like the extradural hematoma or the subdural hematoma or some of the depressed fracture may require surgical intervention, a craniotomy. Medical management consists of observation and medicines to counteract edema along with the anti-epileptic medications and other supportive treatment. Friends, as we all know, prevention is better than cure. So let us learn some ways to prevent head injury. First is always use a helmet or a protective headgear. It reduces the chances of severe head injury by almost 50%. A helmet or a headgear is advised while driving a scooter or playing contact sports like skating, horse riding, etc. Remember to buckle up every ride, however short the distance may be. Also, it is advisable to use an approved car seat or a booster seat for children. Also, the children should be placed in a rear-facing position as far as possible. Elder people are at more risk of fall. Certain measures can help to prevent injury in such people. Balancing and strengthening exercise, regular eye checkups, keep the house and the rooms well illuminated, installing grab bars in the washrooms, using anti-slip mat in the washrooms, arranging for a railing on both sides of the stairs. Such simple measures can prevent injuries in the elderly. To prevent head injury in the children, safety gates can be installed at the top and the bottom of a staircase. Window shield or grills can be used in the windows and the balcony to prevent falling. Television, shelves and other furniture should be secured to the wall to prevent them from falling. Shaken baby syndrome is a dangerous condition caused by vigorous or violent shaking of the infant or a toddler. It should be avoided. Also remember, never drive under the influence of alcohol or the drugs that make you dizzy. Just to sum it up, head injury can have severe and long-lasting consequences on your health. Acting now can prevent dangerous consequences later on. So kindly follow these practical steps to prevent head injury and stay safe. Kindly follow us for more such informative videos. Thank you.